Graves' disease is an autoimmune disorder that primarily affects the thyroid gland, leading to its overactivity, a condition known as hyperthyroidism. In this video, we'll explore how Graves' disease develops and changes over time, from its initial onset to potential long-term outcomes. Understanding the progression of Graves' disease is essential for patients, families, and healthcare providers alike, as it helps guide treatment decisions and expectations. Let's begin by looking at what triggers Graves' disease and how the body's immune system plays a central role in its development. The development of Graves' disease begins with a malfunction in the immune system. For reasons not fully understood, the body starts producing antibodies called thyroid-stimulating immunoglobulins, TSIs. These antibodies mistakenly target the thyroid gland, causing it to produce excess thyroid hormones. This immune response is the root cause of Graves' disease and sets the stage for the symptoms and complications that follow. The process is gradual, often developing over weeks or months before noticeable symptoms appear. As the thyroid gland becomes overstimulated, it starts releasing more thyroid hormones than the body needs. This hormonal imbalance leads to the early symptoms of Graves' disease, which may include anxiety, irritability, weight loss, increased appetite, and heat intolerance. Some people also notice a rapid or irregular heartbeat, sweating, and tremors. These symptoms can be subtle at first, making it easy to overlook the onset of the disease. However, as hormone levels continue to rise, the symptoms become more pronounced and harder to ignore. If Graves' disease remains untreated, the overproduction of thyroid hormones intensifies. This stage is marked by worsening symptoms, such as severe fatigue, muscle weakness, and significant changes in mood or behavior. The body's metabolism speeds up, leading to further weight loss and possible digestive issues like frequent bowel movements. Over time, the persistent high levels of thyroid hormones can start to affect other organs, including the heart and bones, increasing the risk of complications. A common physical sign of Graves' disease is the enlargement of the thyroid gland, known as a goiter. As the immune system continues to stimulate the thyroid, the gland swells and may become visibly enlarged at the front of the neck. This can cause discomfort, a feeling of tightness, or even difficulty swallowing in some cases. The goiter is a direct result of the ongoing autoimmune attack and excessive hormone production, and its size can fluctuate depending on disease, activity, and treatment. One of the unique features of Graves' disease is its effect on the eyes, a condition called Graves' ophthalmopathy. This occurs when the immune system attacks tissues around the eyes, leading to symptoms such as bulging eyes, redness, dryness, and double vision. In severe cases, eye movement can be restricted, and vision may be threatened. These eye symptoms can develop at any stage, but often appear after the thyroid has been overactive for some time. In addition to thyroid and eye symptoms, some people with Graves' disease experience skin changes, most commonly on the shins and tops of the feet. This condition, called pretibial myxedema, involves thickening and reddening of the skin. While not everyone with Graves' disease develops these skin symptoms, their appearance is a sign of ongoing immune activity and can be a clue to the underlying diagnosis. When symptoms suggest Graves' disease, doctors perform a series of tests to confirm the diagnosis. These include blood tests to measure thyroid hormone levels and thyroid-stimulating hormone, TSH, as well as tests for specific antibodies. Imaging studies, such as thyroid scans or ultrasounds, may also be used to assess the size and activity of the thyroid gland. Early diagnosis is crucial for starting appropriate treatment and preventing complications. Once Graves' disease is diagnosed, treatment typically begins right away. The main goals are to reduce thyroid hormone levels and manage symptoms. Common treatments include anti-thyroid medications, radioactive iodine therapy, and sometimes surgery to remove part or all of the thyroid gland. Beta blockers may also be prescribed to control heart rate and tremors. The choice of treatment depends on the severity of the disease, patient preferences, and other health factors. In the short term, effective treatment can quickly bring thyroid hormone levels back to normal, relieving many of the symptoms. However, it may take several weeks or months for all symptoms to resolve, especially those related to the eyes or skin. Regular follow-up visits and blood tests are necessary to monitor progress and adjust treatment as needed. Some patients may experience fluctuations in hormone levels during this period, requiring careful management. With appropriate treatment, some people with Graves' disease can achieve remission, meaning their symptoms disappear and thyroid function returns to normal without ongoing medication. Remission is more likely in those treated with antithyroid drugs, especially if the disease is caught early. However, remission is not guaranteed, and the disease can return months or years later. Ongoing monitoring remains important even after symptoms improve. Unfortunately, Graves' disease can relapse even after a period of remission. Relapse means that symptoms and abnormal thyroid hormone levels return. This can happen months or even years after initial treatment. Factors that increase the risk of relapse include stopping medication too soon, high levels of antibodies, or ongoing immune system activity. When relapse occurs, treatment must be restarted or adjusted to regain control of the disease. For many people, Graves' disease becomes a long-term condition that requires ongoing management. This may involve continued use of antithyroid medications, repeated courses of radioactive iodine, or surgery if other treatments fail. Lifelong monitoring of thyroid function is essential as hormone levels can fluctuate over time. Patients must also be vigilant for new or recurring symptoms, especially those affecting the eyes or heart. If Graves' disease is not well controlled, long-term complications can develop. These include heart problems such as atrial fibrillation, osteoporosis due to bone loss, and, in rare cases, a life-threatening condition called thyroid storm. Eye complications can also worsen, potentially leading to vision loss if not treated promptly. Early and consistent management greatly reduces the risk of these serious outcomes. Living with Graves' disease can impact daily life, especially during periods of active symptoms or treatment adjustments. Fatigue, mood changes, and physical discomfort may affect work, relationships, and social activities. However, with proper treatment and support, most people are able to manage their symptoms and maintain a good quality of life. Education and communication with healthcare providers are key to navigating the challenges of this condition. Graves' disease doesn't just affect the body, it can also take a toll on emotional and mental health. Anxiety, depression, and mood swings are common, especially during active phases of the disease. Support from family, friends, and mental health professionals can make a significant difference. Addressing emotional well-being is an important part of comprehensive care for Graves' disease. Graves' disease can also affect children and adolescents, though it is less common in these age groups. The disease may progress more rapidly in young people, and symptoms can sometimes be mistaken for normal changes of growth or puberty. Early recognition and treatment are especially important in children to prevent complications and support healthy development. Graves' disease can present unique challenges during pregnancy. Uncontrolled thyroid hormone levels can affect both the mother and developing baby, increasing the risk of complications such as preterm birth or low birth weight. Careful management and close monitoring are essential during pregnancy, and treatment plans may need to be adjusted to ensure the safety of both mother and child. As people with Graves' disease age, the way the disease presents and progresses can change. Older adults may have fewer classic symptoms but are at higher risk for complications like heart problems. Treatment approaches may also differ, with a greater focus on minimizing side effects and maintaining overall health. Regular checkups become even more important as patients get older. Managing Graves' disease often involves making lifestyle adjustments. This can include changes in diet, exercise routines, and stress management techniques. Avoiding excessive iodine intake and maintaining a balanced diet can help support thyroid health. Regular physical activity and relaxation practices, such as yoga or meditation, may also improve overall well-being and help manage symptoms. People with Graves' disease have a higher risk of developing other autoimmune disorders, such as type 1 diabetes or rheumatoid arthritis. Regular checkups and open communication with healthcare providers can help detect and manage any additional conditions early. Awareness of this risk is important for long-term health planning. Genetics play a significant role in the development of Graves' disease. People with a family history of thyroid or autoimmune disorders are at higher risk. While genes alone do not determine who will develop the disease, understanding family history can help with early detection and preventive care. Environmental factors can also influence the onset and progression of Graves' disease. These may include stress, infections, smoking, or exposure to certain chemicals. While not everyone exposed to these triggers will develop the disease, they can play a role in those who are genetically susceptible. Reducing exposure to known triggers may help lower the risk of disease flare-ups. At the core of Graves' disease is an autoimmune mechanism. The immune system, which normally protects the body from infections, mistakenly attacks the thyroid gland. This leads to chronic inflammation and overstimulation of the thyroid, resulting in excessive hormone production. Understanding this mechanism is key to developing effective treatments and managing the disease long-term. Thyroid hormones regulate many vital functions in the body, including metabolism, heart rate, and temperature. In Graves' disease, excess hormones speed up these processes, leading to symptoms like rapid heartbeat, weight loss, and heat intolerance. The wide-ranging effects of thyroid hormones explain why Graves' disease can impact so many different body systems. The production of thyroid-stimulating immunoglobulins, TSIs, is a hallmark of Graves' disease. These antibodies are generated by immune cells and specifically target the thyroid gland, mimicking the action of TSH and causing the gland to overproduce hormones. The ongoing presence of these antibodies is what drives the chronic nature of the disease. To better understand how Graves' disease develops over time, let's look at a schematic timeline. This will illustrate the typical sequence of events from immune system activation to symptom onset, diagnosis, treatment, and possible long-term outcomes. Visualizing the progression helps clarify the stages and key decision points in managing the disease. Let's visualize how the thyroid gland changes during Graves' disease. The gland enlarges and becomes more active as it is continuously stimulated by antibodies. This schematic will show the difference between a normal thyroid and one affected by Graves' disease, highlighting the physical and functional changes that occur. Graves' disease can cause distinctive changes in the eyes, known as Graves' ophthalmopathy. This schematic will illustrate the swelling and protrusion of the eyes, as well as inflammation of surrounding tissues. Understanding these changes can help patients recognize and seek treatment for eye symptoms early. The interaction between antibodies and the thyroid gland is central to Graves' disease. This schematic will show how thyroid-stimulating immunoglobulins bind to receptors on thyroid cells, leading to increased hormone production. Visualizing this process helps explain the underlying cause of hyperthyroidism in Graves' disease. Normally, the body maintains thyroid hormone levels through a feedback loop involving the pituitary gland and TSH. In Graves' disease, this loop is disrupted by the presence of TSIs, which stimulate the thyroid independently of TSH. This schematic will illustrate the normal feedback loop and how it is altered in Graves' disease. There are several treatment pathways for Graves' disease, each with its own benefits and risks. This schematic will outline the main options: antithyroid drugs, radioactive iodine, and surgery, and show how patients may move between these treatments depending on their response and disease progression. Graves' disease can lead to several complications if not properly managed. This schematic will summarize the main risks, including heart problems, bone loss, and thyroid storm, and show how they relate to ongoing thyroid hormone excess. Graves' disease often follows a cycle of remission and relapse. This schematic will illustrate how patients may move between periods of symptom control and flare-ups, emphasizing the importance of ongoing monitoring and flexible treatment strategies. Graves' ophthalmopathy can progress through several stages, from mild irritation to severe vision problems. This schematic will show the typical progression of eye symptoms and highlight when medical intervention is most critical. Some patients develop skin changes, especially on the shins, known as pretibial myxedema. This schematic will illustrate the appearance and progression of these skin symptoms, helping viewers recognize them early. Regular monitoring is essential for managing Graves' disease. This schematic will outline the typical follow-up schedule, including blood tests, eye exams, and checkups to ensure ongoing control of the disease and early detection of complications. Supportive care and lifestyle adjustments play a big role in managing Graves' disease. This schematic will show the key elements of a supportive lifestyle, including diet, exercise, stress management, and social support. Graves' disease can affect different populations in unique ways, such as children, pregnant women, and the elderly. This schematic will summarize the special considerations for each group and the importance of tailored management. People with Graves' disease are at increased risk for other autoimmune disorders. This schematic will illustrate the overlap and highlight the importance of comprehensive care and regular screening. Both environmental and genetic factors contribute to the development of Graves' disease. This schematic will show how these influences interact to increase disease risk, emphasizing the multifactorial nature of the condition. Every patient's experience with Graves' disease is unique. This schematic will map out a typical patient journey, from first symptoms to diagnosis, treatment, and long-term management, highlighting key decision points and challenges. Choosing the right treatment for Graves' disease involves weighing the benefits and risks of each option. This schematic will show the decision-making process, including patient preferences, disease severity, and potential side effects. A strong support network can make a big difference for people living with Graves' disease. This schematic will highlight the roles of family, friends, healthcare providers, and support groups in helping patients manage their condition. Graves' disease is a complex autoimmune condition that evolves over time, affecting many aspects of health and daily life. With early diagnosis, effective treatment, and ongoing support, most people can manage their symptoms and lead fulfilling lives. Understanding the progression of Graves' disease empowers patients and families to make informed decisions and work closely with healthcare providers for the best possible outcomes.